Subconjunctival hemorrhage. The conjunctiva is the thin, moist, transparent membrane that covers the white part of the eye. Underneath the conjunctiva lies nerves and small vessels. These are small and barely seen. They are fragile, and when they break, they result in a subconjunctival hemorrhage. Most are spontaneous, and no specific cause can be found. However, sneezing, coughing, straining or vomiting, rubbing the eye, trauma, high blood pressure, and bleeding disorders, like people taking blood thinners like aspirin, Coumadin, or Plavix, can have a subconjunctival hemorrhage. Most of the time it's not associated with any symptoms, but it may be associated with a sense of fullness or irritation of the eye. Examination alone is enough to make the diagnosis. However, there should be no blood if you blot the eye with a tissue. No treatment is necessary. You may use over-the-counter eye drops to treat the eye irritation, like the one in this picture. You must follow up with an eye specialist if the condition does not resolve in 2 weeks, or if you've had repetitive bleeding. Get prompt medical attention if you develop any neurological symptoms like weakness of the face, arm, or leg, slurred speech, confusion, trouble speaking, dizziness, or seizures. If the pain is associated with the bleeding. If you experience any vision changes. If the area of bleeding suddenly increases.
Hello everyone, Dr. Carlo Ogier. Anyone who knows me would know that I wouldn't say this, but I didn't think it was true. On nights that I'm working early the next day, if I'm going to bed and I have a lot of things in my mind starts to wander, and the pressure of falling asleep makes me actually be unable to fall and remain asleep. So the other night I was tossing and turning in bed. I've been like an hour, I've not fallen asleep. And then I went ahead and took the Restmore, 2 tablets. I took them and I said, okay, here goes nothing. And I lay down in bed, and I don't know how long it took, but it didn't take long at all. I didn't toss and turn, I just fell asleep. I thought, well, maybe I psyched myself up. Maybe it was just something else. And the other night, it happened again. Tossing and turning, I need to get up early to do something. Oh my goodness, I'm not falling. I took 2 tablets of the Restmore, and again, within 10, 15 minutes, I was asleep again.